Tachycardia is the rapid pumping of the heart at a rate of more than 100 beats per minute. It is a typical response to exercise or stress. However, if the cause is unknown or left untreated, it may result in severe health conditions such as stroke, heart failure, or cardiac arrest. There are several types of tachycardia, including the following. 1. Sinus tachycardia is a rapid heart rate with a normal pattern. 2. Atrial fibrillation, AFib or AF, is characterized by chaotic and irregular electrical signals in the heart's upper chambers, atria. 3. Atrial flutter is similar to atrial fibrillation, but the heartbeats are more organized. 3. It may or may not require treatment. 4. Ventricular tachycardia, VTach, occurs in the lower chambers, ventricles, resulting in inadequate blood supply to different parts of the body. 5. Supraventricular tachycardia, or SVT, starts above the ventricles and causes palpitations that start and stop abruptly. Possible causes of tachycardia include 1. Fever. 2. Alcohol withdrawal. 3. Caffeine. 4. Alterations in blood pressure. 5. Electrolyte imbalances. 6. Hypothyroidism. 7. Bleeding. 8. Anemia. 9. Smoking. 10. Illegal substances. 11. Medications. While some patients may be asymptomatic, possible symptoms of tachycardia include 1. Palpitations. 2. Syncope. 3. Chest pain. 4. Lightheadedness. 5. Sob. 6. A rapid and bounding pulse. A physical exam and thorough history evaluation regarding the symptoms, lifestyle factors, and medical history is necessary to diagnose tachycardia. To identify the underlying cause, the patient will also undergo diagnostic tests, such as 1. Electrocardiogram. 2. Holter monitor. 3. Event recording. 4. Echocardiogram. 5. MRI. 6. CT scan. 7. Stress test. 8. Coronary angiogram. The nurse will closely monitor patients on continuous telemetry, assess vital signs, and implement advanced cardiovascular life support, ACLS, as necessary. Ask the patient to describe the pain. Identify symptoms accompanying the chest pain. Promote a calming environment. Administer pain medications as indicated. Instruct the patient to cough or bear down as if having a bowel movement. These actions stimulate the vagus nerve to slow the heart rate. Chest pain in tachycardia often results from excessive heart contraction and reduced oxygenated blood supply. Providing supplemental oxygen ensures cardiac muscle relaxation and adequate cardiac oxygenation and reduces the risk of cardiac tissue death, ischemia. Decrease the heart rate by reducing the workload of the heart. Rest periods in between activities will allow the relaxation of the heart muscles. If the patient is at risk for tachycardia due to other medical conditions, ensure activity is limited as tolerated. Assess respiratory status. Gas exchange is influenced by rapid, shallow breathing and hypoventilation. Hypoxia may be accompanied by an increase in respiratory rate, the use of accessory muscles, nasal flaring, abdominal breathing, and panic. Auscultate for lung sounds. Reduced breath sounds are associated with inadequate ventilation. Monitor for the heart rate and oxygen saturation. Hyperventilation and tachycardia will prevent adequate gas exchange. Interventions. 1. Obtain vital signs regularly. Tachycardia can affect the patient's other vital signs, such as a drop in blood pressure. Inadequate perfusion to other organs can quickly result in a life-threatening emergency. 2. Implement ACLS. Advanced cardiovascular life support is training and skills nurses receive to care for patients in cardiac emergencies. This may include administering medications, airway management, and resuscitation. 3. Instruct on necessary testing. The patient may need an echocardiogram, stress testing, event recording, or other diagnostic tests to assess the cause of tachycardia. 4. Assist with cardioversion. The nurse may assist with cardioversion at the bedside or administer medications prior to cardioversion, which shocks the heart back into a normal rhythm. 1. Promote vasodilation. Vasodilators are indicated to help reduce the heart's workload and promote cardiac tissue perfusion. Do not use vasodilators when the patient is hypotensive. 2. Assist with pacemaker or ICD insertion. A pacemaker or cardioverter defibrillator, ICD, may be necessary for patients at high risk for VTAC or VFIB. When the pacemaker detects an irregular rhythm, it sends an electrical pulse to reset the heart rhythm. 3. Emphasize the importance of lifestyle changes. Patients at high risk for tachycardia may need education on lifestyle changes such as weight loss, quitting smoking, substance abuse treatment, limiting caffeine, and eating a heart-healthy diet. 4. Administer antiarrhythmics. Beta blockers, calcium channel blockers, digoxin, and more slow electrical heart impulses.